Welcome to NCPDP, Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators, discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Well, Joel, welcome to the NCPDP Unscripted podcast. Excited to have you on the show.
I'm excited to be here.
Great.
Sunny Arizona.
Sunny Arizona, although it did rain yesterday.
It did. Unusual.
Unusual. Yeah, absolutely.
Kind of like these times in Washington, D.C. Very
absolutely,
unusual.
And we're going to get into that. So I know our NCPDP members probably know you, but some of our listeners probably don't. So can you first introduce yourself and your organization?
Yeah, I'm Joel White. I'm the president of Horizon Government Affairs. That's a Washington, D.C. based consultancy. We do advocacy with Congress and the administration. We also do state level advocacy, policy development, coalition management. So we're in the business of passing laws and trying to make healthcare work better for all Americans.
Great, thanks so much. And I know you're our consultant for NCPDP and when we do our advocacy tours on the Hill. So I know you guys do a great job with that. It's always a lot of fun.
Thank you for saying that. Yeah. It's always a fun time. It's always interesting.
It's always interesting. A lot of walking.
A lot of walking.
So good. Well, so lots of changes in D.C. You know,
Yep.
We're recording this first week of May, and it's been 100 days into the administration, I think last week. So let's start there. Just, what are you seeing after the first 100 days and with this new administration?
The way I describe it is kind of like the party never ends. It is just every day is different. Every day brings a new set of challenges and opportunities. I think one thing your readers might be interested, or your listeners might be interested in knowing is this president has issued 143 executive orders in the first 100 days. Mm-hmm. That is more than twice the normal level of an average president. So he is very aggressively pursuing a set of policy goals to reshape the economy, healthcare, technology, data, the federal government, how it funds things. It is kind of an across-the-board, all-in whirlwind is how I describe it. And at the same time, Congress is really doing quite a bit to try and enact the president's agenda. And so we're seeing a lot of activity from both ends of Pennsylvania Avenue, and it's just a lot to consume and keep straight and stay on top of, quite frankly.
Yeah, absolutely. And I know there was an executive order around drug pricing, I think, in this last week. Can you just share a little bit about that and the impact for industry?
Yeah, and the way I'd tee it up maybe for your listeners is the executive orders are kind of like a memo from the CEO. If you're a part of a big company, the CEO says, here's what we're going to do, here's why we're going to do it, here's how we're going to do it. And that's an executive order. So President Trump issued an executive order on prescription drug policy. Mm-hmm. It's 13 separate sections, so 13 different policies, and they affect everything from drug pricing to drug coverage and reimbursement in Medicare, to importation, to an effort to drive drug costs lower than what's even in the Inflation Reduction Act. So it is a broad kind of brush to say, we want lower costs for Americans, and we want Medicare to stabilize and have lower premiums, and we want basically cheaper drugs. Yeah. So how that gets carried out, like it doesn't just end there. That now Health and Human Services and RFK Jr. have to take that broad brushstroke policy and actually do something with it. And the way they do stuff with it is they redirect funding. They issue regulations. Mm-hmm. They do new demonstration programs out of an agency called CMMI. And they can be very expansive. Like we saw in Trump 1, he did an international reference pricing model. Mm-hmm. Never got off the ground, but we're expecting things like that. These are big, broad initiatives to try and change prescription drug policy. And a big part of that is bringing domestic supply and production back home. So think America first principles. We want to make it in America, we want to consume it in America, and we want it cheaper in America. Yeah. Starting at the top, RFK Jr. is the leader, right? He's the health secretary, which means he runs the largest department in the federal government, spends almost $2 trillion every year primarily in Medicare and Medicaid, but also the Children's Health Insurance Program, the Affordable Care Act, all kinds of the public health responses, NIH, FDA, CDC. So it is an expansive department, and the key driver for Kennedy is the Make America Healthy Again movement, and MAHA, right? So get to know that acronym. MAHA is all about addressing the root causes of chronic illness in America. And so they're starting out with childhood chronic illnesses like cancer, certainly, autism, diabetes, prediabetes, heart disease. But all Americans are affected. 90% of all Americans have at least one chronic illness. And it represents 95% of the spending in Medicare. So it is a big problem. And they think they've tapped into a big cultural movement where I think most Americans, at least at a basic level, understand that the food I eat, what I drink, the environment, the water, the air, the pollution, maybe even some people, the vaccines or the drugs that I take can affect my health at a fundamental level. And I think RFK Jr. Believes that all those things contribute to rising incidence of chronic illness. We have an epidemic in this country, and they want to get to the root cause of that, figure out what's going on, and design programs to really reshape that. But he's also charged with this drug policy. He's got to do that, and it all kind of fits together and weaves together in this Make America Healthy Again narrative, all built and wrapped around the America First agenda. Like I said, bring it home. We're going to consume it here, and we're going to consume it for cheaper.
Right. Well, I know at NCPDP, we're talking a lot about the expanding role of the pharmacist, right? And to me, with the MAHA agenda, I think if you're focused on chronic care management, pharmacists can play a big role in that, right? Because they can, track the patients. They can patients see their pharmacists a lot of times more than their provider. So just curious if you see, kind of NCPDP, the role of the pharmacist, the impact on the chronic care, if there is going to be a focus on that, kind of how you see that shaping up.
This is where I think it gets exciting, okay? Because however you feel about Trump, let's just put your politics aside, they are committed to addressing chronic illness. And pharmacists are uniquely positioned in the healthcare ecosystem to intervene. They see the patient most often. They are often dealing with medication problem lists or adverse events or trying to keep people healthy and manage their illnesses. Perfectly positioned to have an impact on keeping people healthy, but also managing their chronic illnesses when they develop. So as we think about HHS restructuring and the programs they want to pursue, we think things like facilitator model or the PEI, the identifier, or the product locator, for example, are all critical pieces that fit within the MAHA agenda. And those create opportunities to be able to go into HHS and say, if you want to manage chronic illness, if you really want to keep people healthy, here are 3 tools in the toolbox that you could deploy pretty quickly to help do that. And so that's exciting. I mean, certainly there are threats, and we've got to manage those too. But pharmacists and pharmacies are really uniquely positioned at this point in time to make a big dent in the incidence and management of chronic illness. It fits right in with that agenda.
It's fantastic. I mean, that's what I'm excited about. So, one of the things that we talk about also as pharmacists start to think about doing more of these clinical services is the reimbursement piece. So I know there's something called ECAPS. Can you describe that a little bit? And if you think that this is something that we'll see in the next with this administration.
We have 3 branches of government, and this is really Congress. And as I mentioned, Congress is really focused on a budget bill and trying to enact the president's agenda. But one of the items in that's a big bill. It's about $6.5 trillion. I know we can't even think about like how much is that. Can't even imagine it. But it's huge. It's massive. It is a big piece of legislation. So there's a lot of pieces of that. There's taxes, there's border security, there's defense, but there's healthcare. And one of the issues that's been plaguing physicians in Congress is year-over-year annual payment cuts in Medicare. It's driven by the law, but the regulations put it into place. And really it needs Congress to fix it. Well, that piece is most likely to get addressed in this budget bill. And a key player in Congress, the chairman of the Ways and Means Committee, has said, if we fix that, I want to make sure pharmacists are reimbursed for the services that they provide in their scope of license. So think immunizations, right? Testing, chronic care management services, all of those things, part and parcel of the ECAPS bill.
Okay.
So ECAPS is on the list in a way I've never seen. I've been in D.C. for longer than many people would care to have me there, but almost 30 years. It is the best positioning for this ECAPS legislation I've ever seen, which means if we start reimbursing pharmacists for those services, we got to get ready for the clinical type services that they need to provide. And what do they need to do that? They need information, they need data, they need connectivity and interoperability with physician clinical records and other management systems to put that information right in front of them so that they can deliver those services not just appropriately for the patient, but also get reimbursed for them, manage their illnesses, fits in with the MAHA movement. So it's all really exciting in my opinion. We're tracking it very closely. That bill that I'm talking about, that big, massive bill, they call it the one big, beautiful bill, that is slated, they want to get it to the president by July 4th.
Oh, wow. Okay.
So we'll know here in a couple months whether we better prepare for that.
Yeah, no, it's fantastic, and really, a lot of what we're focused on right now at NCPDP. So we're down to our last minute or two. So, as we move beyond the first 100 days, right, what should we as kind of the healthcare professionals, pharmacists, PBMs, health plans be thinking about as we kind of move forward with this administration?
Well, like I said, you can get lost in the noise. This is a lot coming at us, a lot of change. I think staying true to the North Star, like NCPDP is very good at convening experts from many different industries to drive standards so that we have the data to make healthcare work better for everyone, right, for the common good. And I would keep doing that. It fits into this administration because they don't want the government to do everything. They want to partner with the private sector, especially people in technology and data, to be able to advance their agenda. And so I think if your listeners aren't engaged with the what's happening in Washington, get involved. Get involved in your local pharmacy association or your PBM industry group or however it is. Even just go to house.gov or senate.gov. Figure out who your member of Congress is. Weigh in. Get active and engaged. This is an exciting time. It can be troubling time too, but weigh in, be active, and tell Washington what we need and why we need it.
Yeah, fantastic.
Yeah.
Well, thank you so much, Joel. It's been a great conversation, and we're looking forward to seeing what happens with ECAPS and kind of everything else around this. So
I am too.
Good.
I really appreciate being here.
Yeah, excellent. Thank you.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.